Hello and welcome to Rajya Sabha Television. I am Vishal Dahiya and you're watching our show India Fights Back, wherein we talk about all the efforts being made by India vis-a-vis the corona pandemic. Now, as all of us know, just like every other virus, the novel coronavirus, which is the cause behind SARS-CoV-2, which is better known as COVID-19 as well, is also mutating. There are several mutations which have been detected. There are several variants also present across the globe, and three of them seemingly have become a cause of concern. The British variant, which is prevalent in UK and was detected somewhere in December, and also two other variants which are known as a South African variant as well as a variant from Brazil. Although ICMR recently has said that they have successfully cultured the UK variant, and Biotech's vaccine has a very good immunogenicity against this particular variant and others which are prevalent in India. So we'll try and understand all about these mutations, these variants of novel coronavirus, and their correlation with the vaccines which are already there in the market and also those which are being developed there, as to how effective these vaccines are or will be against these variations of novel coronavirus. And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Pragya D. Yadav is joining us. She is Scientist E and in charge of the Maximum Containment Laboratory at ICMR NIV Pune. We're also joined by Dr. N.K. Ganguly, former Director General of Indian Council of Medical Research, and Professor S.S. Vasan, the COVID-19 project leader at CSIRO Australia. Welcome both Dr. Ganguly, Professor Vasan and Dr. Pragya there as well to Rajya Sabha Television. Let me begin with Dr. Ganguly here first. And Dr. Ganguly, let's first make our viewers understand the logic or the entire concept of mutations or variations when we are talking about the novel coronavirus.
Actually, as the virus goes on transmitting, it goes on mutating. Some of the mutations become significant. So one of the strategies is that vaccinate the population as quickly as possible so that the transmission stops and mutations get stabilized. So as you have said, there are 5 mutations now which are of worry: the UK, Brazil, the South African, German, and now there is one US mutant. Previously, it was known that these mutants only efficiently do transmission, but now it is known that South African as well as the Brazilian mutant can cause more virulence and can cause more death. And if they are in asymptomatic patients, if they are super spreader, they spread very fast. Recently, it has been seen, previously it was known that the vaccine may work very well, but vaccines are not working that well with the Brazilian as well as the South African mutant. The Regeneron, who has created these monoclonal antibodies, first brought out data that that their mix of 3 monoclonal antibodies are not really that efficient in suppressing the South African and Brazilian strains. And now we have a data out of the both Pfizer, Moderna as well as AstraZeneca vaccines, that these vaccines also are not that efficient, although they are working, but their efficiency is lesser for the South African and Brazilian strains.
Okay.
So they are coming up with new propositions, and one of the proposition is that give another booster around 5-6 months away to strengthen the immunologic response so that the vaccine could take care of these dangerous mutants. However, the worry is that these mutations may sometimes, if they go on, and sometimes they take a shape that the vaccines don't work. So one of the strategies which the US and at least is taking, that do the mass vaccination of the population as quickly as possible to prevent transmission so that they mutate less.
Okay.
I will end with one more point, that there is a immunologic derived mutation also, which occurs in more viruses. If you put immunologic pressure, the virus mutate. So this happens in for many viruses. This may happen here also. So one of the strategies is that stop transmission as quickly as possible in the population so that the mutation breaks.
Okay, and we'll talk about the vaccine correlation there as well. But let me first bring in Professor S.S. Vasan here from CSIR Australia. Professor Vasan, from your point of view, in terms of these various mutations, and also how concerned all of us should be vis-a-vis all these variations and mutations in play here.
I said this before in this show. I think it's very natural for this virus to mutate. There's nothing alarming about that. And in some sense, we expect this as well because the virus is coming under a huge selection pressure. This is a combination of two things. One is you have lockdowns combined with the rollout of the vaccinations. So we are just about beginning to see interesting mutations that the virus throws up. And over the last 1 year, so in my lab here, we've been closely following the story. There was another mutation called D614G, and we showed for the first time using laboratory studies backed by computer modeling that that particular mutation will not affect the efficacy of vaccines, including the Oxford vaccine, which is rolled out in India. Similarly, there are studies that show that there's another mutation which is known as N501Y. So studies have been done to show that those single mutations are not going to be a big problem. However, what has happened, as Ganguly Saab mentioned, is these particular three variants, and there is another one variant as well called the Danish cluster 5. So in these different variants, you have a set of mutations which have all joined together. So this is something we predicted back in March that will happen. So this is what we call accumulated mutations. So mutations are random events in some sense that they're not premeditated, they happen by chance, but those mutations that confer an advantage are likely to be selected and will spread. So what you are seeing now is actually all the various variants we talked about, the British, the South African, and the other Brazilian, and so on. They all have this background D614G mutation, and many of them have the N501Y. That wasn't present in the Danish, but it's there in everything else. Similarly, there are some other mutations. For example, there is a deletion in 6970 in the spike, and that is present in the Danish as well as in the British one, but not in the South African. So you are once again, you are seeing that there are these mutations which we have been closely watching, single mutations, which are either substitutions or deletions, but which we are now beginning to see forming an accumulation in different parts. And it's that accumulation which in some cases, as Ganguly Saab mentioned, like in the South African in particular, there appears to be an adverse impact on the neutralization, that the antibodies are able to not neutralize the new variant as efficiently as before. Now, this happens all the time, even, for example, in the influenza. This is very well known, which is why you have to do what we call vaccine matching or tweaking the vaccine. I did not believe that we had reached that stage yet. We probably still haven't reached there yet, but it is excellent to see that some of these companies are already thinking about tweaking their vaccine so that in about 6 months to 1 year's time, the subsequent booster doses can take care of these variants.
Okay. They are seemingly also, pointing to what exactly is being done as far as the vaccine front is concerned. And brings me to Dr. Pragya here. Dr. Pragya, India has successfully isolated scientists in ICMR and cultured the UK variant out there as per the information, and also said that the Bharat Biotech's vaccine, the Covaxin, has a very effective, strong immunogenicity vis-a-vis this particular variant and others there as well. So what's the situation vis-a-vis the novel coronavirus variants which are present in India and the vaccines which we are using right now? Dr. Pragya?
Thank you, Mr. Vishal. Yeah, thank you, Mr. Vishal, for bringing up this issue, which is very important at the moment. And in this line, as soon as we got this thread that UK variant may enter to the India, we started efforts for virus isolation, which we did in this first week of the month, and it was declared, where we found that UK variant has all signature mutation, which is labeled 17 mutations. In a simultaneous, a different vaccine, which is already rolled out in different part of the world, started working to see if their vaccine is effective. And there was two papers which came up last week and prior to that in Biotech, and that first is G et al., where they have generated an isogenic Y501 SARS-CoV-2 on the genetic background of the N501 clinical strain, and they use to do the PRNT assay with 20 participants of the vaccinee sera after 2 and 4 weeks of immunization with 230 microgram doses of BNT16B2 vaccine, and they showed that there was no reduction in neutralization activity against Y501 spike. But the limitation of this study was that it was not a real virus. It was only presenting few of the mutation. In the same line, Wu K et al., the mRNA vaccine 12C373 also they have done a recently study, and they released the data that they did neutralizing antibody against spike mutant from global SARS-CoV-2 variants, and they have shown not only the human sample but non-human primates immunized vaccine sera samples showed a very effective neutralizing response against B117 variant, which is UK variant. But however, they have also shown significant reductions in neutralization with B1351 variant. So that made us also to do this study, because our vaccine program has launched on 16 January, and many people raised this question if Covaxin, which is the indigenous vaccine of the India, will work against these mutations or not. So we isolated this virus, and we used serum sample of clinical trial in 38 numbers, and not only with the UK variant, but also, as you just want to tell that this virus was used from a patient who was COVID positive and classified as a G-clade. So the vaccine belongs to G-clade, and this mutation, which we are saying UK variant, is also belongs to G-clade with the variations, and that's what with the different classification it is called variant of concern. And we also included one more strain from unclassified group, where they do not have these known mutations of G-clade. So these three different strains were used for doing a PRNT assay with the vaccinee serum, and we found with the vaccines. So this data actually has assured a very high level of confidence that ongoing vaccination program will be successful with the any variant which is introduced. As both our earlier speaker has said, that the virus, it is a negative strand virus, and variations and mutations will keep happening, and this vaccine will able to tolerate and show good protections against the disease.
Okay. So let's also bring in here now, Dr. Ganguly again. Dr. Ganguly, as both Dr. Pragya and Professor Vasan pointed out, in terms of the correlation between these variants, the novel coronavirus variants and the vaccine, and you were also referring to this particular correlation earlier. The question here is that how much time it might take for the vaccines to be tweaked, and how long this process might go, because as far as from the layman's understanding, the viruses will keep on mutating.
Yeah, this is a very good question. Actually, the tweaking has already started at least by the messenger RNA companies. The messenger RNA can be tweaked very, very quickly, and its production can be also enhanced very quickly. When you do with the whole virus, the tweaking is very difficult, because you have to use a cluster of viruses to do that. But for the messenger RNA, it is very, very easy. For those who are using virus-like particles, there also you can do it much more quicker, because the fermentation process is also very, very efficient, and the design is also very, very efficient. That is why in the influenza viruses, the ones which are very efficient in recycling the new viruses without waiting for more time is also the virus-like particles. But messenger RNA is a new one, and this could be tweaked very, very easily. So the main thing is this, that they have to start now, because as Dr. Vasan has said, even the Danish strain, the new neutralization assays. I'm not using many technical terms because we are addressing lay people, but that also is creating a problem. And as Dr. Vasan said, that when the mutations occur in clusters, it becomes much more stronger, and it is very difficult to neutralize.
Okay.
So at this given moment,
Okay,
it will
I'll have to stop you here, Dr. Ganguly, for just 1 minute. We have a bit of an issue here. Yes, PCR. कौन से गेस्ट चले गए? तो आप दूसरे गेस्ट
Vishal, we can't hear you.
Are we ready? ड्यूरेशन कितना हो गया? ओके
अभी देखिए, हाँ ठीक है, ओके
गाइस Dr. Ganguly, I'm sorry for the interruption, but I believe you can start from there. You're talking about how the vaccines are going to work in the long term.
So normally what happens, like in influenza virus, the surveillance gives you idea of which are the new strains which are circulating, and from that a new vaccine is generated without much regulatory attempt. They are agreed upon, and you have not to go through the whole course. So messenger RNA vaccines will be the easiest, because these are the synthetic vaccine, and their fermentation process is also very, very easy. Their delivery systems will remain the same. So messenger RNA vaccine guys have already started tweaking this, and they are getting ready. The other one, which is very easy to tweak out of the platforms, will be the vaccine-like particle generated vaccine. This can also be very quickly done. The third category, which could be very quickly done, are the one which are being done by the Covax. This is a VAAX. These are the protein these are the protein antigens. So these are chimeric protein. This can be also very quickly generated. So there are several platforms which can very quickly generate the next generation vaccine, and the regulatory attempt are if the same as it is in the influenza vaccines. This will be very quickly introduced if there is a need. And I think that there is a need for this, because the way the mutations are occurring in some countries, even though in the population the antibodies are there, but the virus is raging, it will be very, very important that we become ready for this. Final bite I will try to give is this, that we need to strengthen our surveillance, particularly the molecular surveillance, wherein we can get whatever we need to know about these viruses and how they are changing and how they are responding in the immunized population. This will be very, very important to know. Some of the countries do surveillance, we also do surveillance, but we have to really reach the level in which the UK does the surveillance. And now the US is ramping up its surveillance. So this molecular surveillance, this will be very, very important input in the effort for vaccination.
Okay. Indeed, surveillance, specifically the molecular surveillance, is really, really important, something which has been underlined by various experts earlier as well. Let me bring in Professor Vasan here. Professor Vasan, as you were also earlier pointing out that, perhaps earlier the scientists didn't believe that the tweaking of vaccine stage will come so quickly, but now that we are here and the companies have also started thinking about it, the vaccine manufacturing companies and the platforms which were mentioned by Dr. Ganguly there as well. So the question here is, for a layman's understanding, are we, as a scientist, would you agree that we are not too far behind when we are looking at the mutations or the variations part of the vaccine, and all aspects are being looked into and they are being followed?
That is absolutely true. I would say that we are not that behind the virus. So a number of efforts are going on to understand the mutations. There is unprecedented cooperation between scientists in different countries and sharing this information, sharing isolates, and that's really something to be proud of. Now, I would echo what Ganguly Saab said, which is that in influenza, you have a new vaccine, one for Northern Hemisphere, one for Southern Hemisphere every year. And this tweaking happens, this tweaking is known as vaccine matching, and it happens almost year after year, and it goes without too much of trouble. I don't believe, compared to the rate at which the influenza virus mutates, if you compare this virus, it has a proofreading mechanism, an exoribonuclease mechanism. So I believe that this will be slower mutating than the influenza virus. Therefore, we don't need to panic. And we already have, as Ganguly Saab mentioned, all the mechanisms in place to handle even the seasonal influenza without any issues. So there is no reason to believe we can't do the same. And indeed, the mRNA vaccines have the biggest advantage in that they can be tweaked very easily. But we also need to be balancing that in terms of pragmatism. mRNA vaccines are also more expensive compared to, for example, the Oxford vaccine, the adenoviral vector vaccine, or the ICMR's vaccine, for instance. Main reason is also cold chain. So in smaller countries, developed countries, which are not very big, like say Singapore, Australia, it's not that much of a problem with cold chain. But when you have large geographic distances like India, and you have a lot of rural infrastructure, cold chain is not that easy to sort out in such a short time. So this is one of the big thinking behind why India is using the ICMR and the Oxford vaccines, because they are more suited to our conditions locally. And the good news is that certainly with the Covishield, the Oxford vaccine, which we evaluated in my lab before it went into humans, we did the ferret studies. Those vaccines can also be tweaked without too much of a difficulty.
Okay.
Let's bear in mind these vaccines were ready for evaluation in my lab. They were sent to me in February, and the virus was, sequences are only made available in January, so they can be tweaked, and the same applies for mRNA. So I don't see there is a need to panic, and I also believe that the companies and the universities are doing the right thing by starting now, so that you will have a booster in about a year. The other question you asked me in a previous show, whether we will get this by new variants in India, and I said to you at the time, it's not a if, it's a matter of when. They will find its way here, but we just need to do better surveillance in order to pick them out. And one of the things I mentioned is, whenever you get an imported case of COVID positive imported case, it's better to sequence the virus and see what mutation there are. And even though sequencing is expensive in the long run, doing that for all imported cases is really critical for us to understand what's coming into the country. And the other point I will also say is that India has excellent infrastructure in NIV and other ICMR institutes, IGIB in CSIR, and we can very easily handle that in terms of understanding what mutations are there, which are locally relevant to India, and to test whether the two leading vaccines we are rolling out, are they still able to sufficiently neutralize. One of the points that is not often spoken about is people are concentrating too much on one side of the immune system, the B side, but there is also the T side of the immune system. So we also believe that we need more data to understand whether the T side of immunity is able to protect us in the long run. And I believe that may well be the case.
Okay, that indeed is a very, very interesting point, and we would like to, have a separate debate on there with both Professor Vasan and Dr. Ganguly and other experts there as well. Thank you so much for the meanwhile, Professor Vasan, Dr. Ganguly and Dr. Pragya, for sharing your views there. As our experts were pointing out, clearly, there are variants and mutations which are a cause of concern, but then our vaccines seemingly, and the scientists working on those vaccines are pretty much prepared to deal with these variations and mutations by tweaking those vaccines. And as Dr. Pragya was also pointing out, ICMR has already said that the Bharat Biotech's vaccine has a very good immunogenicity as far as the UK variant is concerned. But apart from all this, that is vaccines being in place, there is one very important factor which all of us need to keep in mind, and that is the COVID appropriate behavior, the one aspect which will keep us safe. 3 simple steps. You have to wear your mask at all times. Also ensure that you maintain hand hygiene by washing your hands regularly, and also ensure that you maintain physical distance of 6 feet while you're out there in public space. These 3 simple steps will keep you and your near and dear ones safe. So keep watching Rajya Sabha television, and please do not forget to ensure the COVID appropriate behavior. Thank you.